Isaac. I'm going to be performing the newborn assessment today. This here is baby Henry, who was born 6 hours ago vaginally with no complications. He is a Caucasian baby. Uh, Before I get started, I'm going to perform proper hand hygiene, glove myself up, and upon first general observation, I can see that he's a Caucasian baby. His coloring is pink with no acrocyanosis noted on his extremities. His posture, he is a good bit flexed. He's a little bit active right now. He was fed not too long ago. Upon inspection of his proportions, his head is a quarter of his total body size. And I'm noticing he's got a little bit of movement. It is equal bilaterally. And upon inspection of the skin, I'm noticing no abnormalities, no bruising, stork bites, mottling, or anything of the sort. So he was measured at over 3,000 grams. And I'm going to be measuring him now with my tape measure. His length is about 52 centimeters in total. I'm going to measure the circumference of his head at the brow, and it is about 34 centimeters. I'll be checking his chest circumference at the nipple line, and it is about 31 centimeters. Moving on, I will be conducting a respiratory assessment now. I'm going to be performing it. I will be measuring it by observation for 60 seconds, starting now. I counted about 50 respirations, and the reason why I would want to measure it out for 60 seconds is because newborns have very irregular breathing patterns, which is why we need to count for the full minute. And I did not notice any signs of respiratory distress. The 6 signs would be grunting, substernal retractions, circumoral cyanosis, tachypnea, asymmetrical chest rising, and nasal flaring. And also going to be auscultating his breath sounds. I would need to use a pediatric stethoscope. Reason being, because this is a smaller human, I would need a smaller stethoscope. For the purposes of this assessment, I'm just going to be using the Bell on this regular size stethoscope. So I would disinfect it first and foremost, and I would typically want to start on the newborn's right side, so I would get less heart sounds. So that is what I will be doing. I'm also going to be sure to check on the infant's sides. And the lung sounds were clear. If the baby was born via a cesarean delivery, we would probably hear some fluid in the lungs because since would not have been birthed through the vaginal canal, that compression would not happen, causing the fluid to be expelled from the lungs. Next thing I will be assessing is the apical heart rate. On a newborn, instead of going to the fifth intercostal, you would go to the third intercostal. And instead of the mid-clavicular line, you would be a little bit lateral to that. So first and foremost, I'm going to locate the mid-clavicular line. I'm going to go down to the intercostal. I'm going to go ever so slightly to the left of that. And I will now listen to his pulse for a full minute. I counted over 140 beats per minute. The next thing I will be doing is assessing the brachial and femoral pulses. I have located both brachial pulses. They are equal. They are 2 plus. And now I'll be going to the femoral arteries and doing the same. Equal bilaterally, regular rate. The rate of the brachial arteries was regular as well. I'm going to say those are a +2 as well. And the normal blood pressure for a newborn is going to have a systolic rate of 65 to 95 and a diastolic of 30 to 60. We would not normally conduct a blood pressure check on an infant unless we noted certain discrepancies, like let's say the right rhythm was different from the left, and so on and so forth. Next thing I'm going to do is inspect the head. I'm noting all of these suture lines. They're well approximated. And I have located the anterior fontanelle. It is the larger of the two. It is diamond shaped. And I have also located the posterior fontanelle. It is the smaller of the two, and it is triangle shaped. If both of them were to be depressed, that would be an indication of dehydration. And if they were puffed out, it would be a sign of potential volume overload. There is no caput succedaneum or cephal hematoma noted. Caput succedaneum is going to be when the baby gets a little bit of a cone-shaped head due to it being pressed against the cervix for a prolonged period during a vaginal birth. It is able to cross the suture lines. It is not a problem. It is usually resolved within a couple days of birth. Now, cephalohematoma is when there is a hematoma pooling of blood. Key difference is that it does not cross the suture lines. It stays within them, and that can take weeks to months to resolve. I'll now be assessing the eyes. Since baby Henry is a newborn, his eyes are going to be a little bit more of a gray color. He doesn't quite have the color to them. Now going to shine this light to his eyes. Do the same on the other. Pupils are equal and round and reactive to light. However, because he is a newborn, they cannot accommodate yet. Also located the pinna of either ear, and they are in line with his eyes. And I have not noted any periocular skin tags. If I were to notice them, that would mean that his ears and kidneys were developing at the same time, and that could indicate potential renal problems. I'm now going to assess the nostrils now. I'm going to check them for patency, and how I do that is I'm going to make sure his mouth is closed. I'm going to close one nair, make sure that he's breathing out of the opposite nostril. And I'll do the same for the other side. And nasal patency has been noted. Next, I'm going to check the mouth. First, I would have gloves on, as previously stated. I'm going to verify that there is a sucking reflex. And I'm going to check for rooting. How I will do that is I will stroke his cheek, and his head will turn towards that. It is noted. And his face is symmetrical, so that means that there's no facial nerve damage. And looking inside of the gums, I'm not noticing any Epstein's pearls, which are little white pearls in the gums, although this is normal if it is noted. There is no circumoral cyanosis present. And if he were to, let's say, hypothetically begin crying and we would note circumoral cyanosis, that could be an indicator of potential congenital heart defect. Okay. Next, I'm going to assess his neck and thorax. He has a lot of skin folds. He has a very short neck. There's no webbing noted. I'm going to make sure that his head can turn from side to side. That is good. There's also no abnormal fat noted. I'll be checking the chest and clavicle. Once again, the chest is symmetrical. I'm going to run my finger across either clavicle, assessing for any breaks that would have occurred intrapartum. There are no clavicle breaks noted. Also going to be assessing his nipples. He has two of them. They are equal. And I will be moving on to the abdomen next. So I'll be assessing vowel sounds. Now, typically, infants do not have very active bowels. Peristalsis is noted. The bowels will not start making noise until they get more feedings, whether that's formula or breastfed. So I will start like on an adult with the right lower quadrant. I'll listen for 30 seconds for all four quadrants. Once again, peristalsis has been noted. Next, I'm going to assess his stomach. It is soft, round, and symmetrical. I'm also going to assess his cord. I'm noticing 3 vessels. That would be 2 arteries and 1 vein, although at this point it is hard to discern, but it is noted that there are 3 vessels. And there is no bulging. I'm noticing no signs of infection either. I'll be moving on to assessing his extremities. The first of which is going to be the mortal reflex, and the way I'm going to do it is I can also assess the palmar reflex by putting my fingers into either of his hands. He is grabbing, so the palmar reflex is noted. I will then lift him up by the arms, keeping his head in contact. And I will drop the arms. Now you can't see it on the doll, but what would happen is whenever you pull up the arms and you release them, fingers shoot out, and the arms almost spasm on the way back down. So more reflex is noted. I'll now be assessing for any hip defects by going with each leg, rounding it, and assessing for any pops or crackles. There are no pops or crackles noted. And from there, I'm going to check his hands and his feet for any potential additional digits. Also making sure that there are creases in his hands. It's not a Simeon's crease, which is just one singular. So that is good. Also assessing for any excess skin. No extra digits noted on the hands or feet. I will now be assessing the plantar reflex. Is whenever I press my finger into the bottom of the foot and the digits grab around it. Also be checking for the Babinski's reflex, which is where I hold the foot up and I take a finger, I stroke the heel. His 4 smaller digits would fan out, and his largest digit, the big toe, will dorsiflex. And the Babinski reflex is noted bilaterally. Now be moving on to assessing the back. So because he does not have strong neck muscles and his head is very large in proportion to his body, I'll make sure to have proper control of the head and the neck. Pick him up and now assess his back. It is straight and flat. I am not seeing any sort of indentation or tufts of hair along the spinal column that would indicate spina bifida, which is a congenital defect. Also assessing his sacrum. So his diaper would be exposed at this point. I'm assessing the sacrum for any sort of dimpling. I am not seeing any dimpling. That would indicate a pilonidal cyst. There is no Mongolian spotting noted either. Now turn him over. I will assess his genitalia. I see that both of his testes have distended. They are palpable. They are equal. I am not noticing hypospadias or epispadias either. Okay. I would also have checked his anus for fissures as well. There is no fissure in the anus. So I'm going to get him wrapped up, cleaned up. I will take him back to mom and dad and the rest of the family that is present. I will then remove my gloves. I will wash my hands. I will make sure that they have the call button, and I will give them privacy. And that concludes